Las Vegas, Nevada. A city that promises to fulfill every fantasy and every desire.
I've been wanting breasts for a long time now, and I'm gonna finally do it.
Because it's anything and everything money can buy. Some will undergo radical surgery to achieve a perfect look.
It's human nature to be a little nervous to be cut on.
Others will wreck their lives chasing a $1 million win.
I lost everything that I had made, plus all the money I borrowed, begged, and stole.
Because in Las Vegas, the defining culture is of vanity and excess. Las Vegas Boulevard is Main Street, Las Vegas style. This is where the fantasy
All right, let's go over it once more.
and the work begin.
5 and 6, 7 and 8.
For the 11-member cast of Crazy Girls, it's a repeat performance twice a day, 6 days a week.
Girls, girls, crazy girls.
Landing a role in one of these mega shows is anything but simple.
Giving up heat.
Competition is fierce,
It depends on how big the show is, but they may only be looking for 1 or 2 girls.
and vanity is everything.
They want you to be tall, beautiful. You know, they want to see that you fit in with the girls. You have to blend in and look like they do.
5, 6, 7, and 8. There's 9 girls in the show, and of those 9, 6 girls have implants.
29-year-old Rayma Alfred has been training as a dancer since she was 5. She's in great shape,
Feel okay?
but to her, it isn't enough. So in just 48 hours, she's going to have plastic surgery.
In 2 days, I'm gonna have breast augmentation done. And I'm getting it done because I want my body to be more proportioned and I want to feel more sexy on and off stage. This is one of the costumes that I wear and one of the numbers. And as you can see, I look very voluptuous, but that's because I have breast pads sewn inside of it. And hopefully after my augmentation, I won't need those and I'll just look this way naturally.
2,500 miles away in Philadelphia, Dr. Arturo Garcia is in the throes of his Las Vegas routine.
1 pack of brain enhancer,
It's a complicated ritual
1 pack of essential nutrients.
filled with pills and potions and daily injections.
Real easy. This goes in.
Dr. Garcia is on a mission to stay young.
My lifestyle basically consisted of no breakfast, coffee in the morning, then going to the office, more coffee, again, no breakfast in the office, no lunch. And it looks great.
It all started last year on his 40th birthday,
That looks very nice.
when this successful dentist realized he felt much older.
I was working long hours here, traveling, teaching, very hectic lifestyle, and I started to feel, tired and run down, not having the energy to do what I wanted to do.
Please report immediately to gate D2 for an on-time departure.
Garcia went to Las Vegas in search of anti-aging medicine, with the hope that it might help him fight off his family history.
Having some family health history that, for instance, on my father's side of the family, history of cancer and heart disease at a relatively young age, I don't want to go through all that. I've seen it ravage and destroy a lot of people's lives, and I want to stay as healthy and active as long as I can to do what I love to do.
Garcia found what he was looking for, a health program built around diet, exercise, and daily doses of over-the-counter supplements and prescription hormones that are designed to fight the effects of aging.
I was 20 pounds heavier than I am now. I was tired a lot more. My body shape was different. I didn't have as much muscle mass as I have now. Not that I'm a bodybuilder, nor that's not my goal either. I just want to be fit and healthy.
Now, everywhere Garcia goes, so does his bag full of supplements, the core of the anti-aging program prescribed for him by the people at the Cenegenics Institute. Cenegenics is the brainchild of its founder, 63-year-old Alan Mintz.
Welcome back.
Hey, Alan, how are you?
It's a pleasure to see you. I know we've been talking. You said you've been
Trained as a radiologist, Dr. Mintz is passionate about not getting old.
Cenegenics is focused on 4 things: keeping our brains really healthy, energy, including sexual energy, a strong immune system, so we either delay or prevent things like heart disease, stroke, cancer. Maybe we'll live longer, but higher quality of life. And the fourth issue is really self-esteem, body composition. How do we feel about ourselves?
Anti-aging medicine is one of the fastest growing medical specialties in the U.S. The objective is to rebalance hormone levels that drop with age through hormone replacement therapy. Since Cenegenics opened in 1997, people have been paying up to $15,000 a year to buy, in essence, time.
People come to Cenegenics from all over the world, primarily business and professional people, mostly 40 to 70 years of age. Our youngest patient is 29, our oldest is 97.
Cenegenics is a sort of cross between a hotel and a clinic.
Each patient is here for the day and they have an entire room to themselves. This is their space for the day, so they set up their computers. They're in touch with the outside world.
Once a year, patients spend an entire day undergoing top-to-bottom physical and mental evaluations by a team of specialists.
We have physicians, nurses, nutritionists, technicians, all here to take care of the specialized needs of each of our patients.
I'm going to have you lay down on the lunar here.
Garcia is about to find out if this $1,500 a month ritual has been worth all the effort. He's returned to Las Vegas for his first checkup since starting the program a year ago. The engine that drives the Las Vegas economy is gambling. It generates $6 billion a year in revenue, much of it in small bills and loose change. Every year, the 35 million visitors who come here each spend an average of $200 a day at the tables and machines. But for some, it's more than a frivolous pastime. It's a game of self-destruct.
My game of choice was video poker. And when I was doing desperation gambling, like when the money started to go, I would go to the blackjack tables.
Vodka and tonic, please.
Vodka tonic, lime.
37-year-old Kim Bryant works at the Venetian Hotel and Casino.
Thank you. Good luck.
Every day, she is surrounded by the familiar sounds of gamblers getting lucky.
Good luck.
Ironic, because when gambling took control of Kim's life, her luck ran out.
These were the things that destroyed my life, you know, that destroyed me. And it's not that it's bad, it's just that I couldn't control it. Most people, as you see, come in and they gamble and they have a very good time and they go back to their normal lives. I couldn't do that. It was impossible for me to do that because I have an addiction.
Back in high school, Kim was the person voted most likely to succeed.
Morning.
By the age of 26, this single mother of two hit rock bottom.
It was chaotic. It was insane. I didn't know how to behave. I had lost the ability to function in a normal setting. Efren, here's your tip.
Kim's troubles began when she turned 21 and went to work at a Las Vegas casino. She remembers the excitement of hitting her first royal flush.
The royal flush, you think it's your big opportunity, your big win, and really that's the time when you really dive deep into the addiction, because I have the mind that says if I can win one, I can win another.
A year later, she was spending 8 hours a night at the tables.
It starts out fun, and then it's fun plus problems, and the final stage of it is just problems.
5 years of continual gambling destroyed her life.
Financially, I lost everything that I had made in that period of 5 years. I lost that, plus all the money I borrowed, begged, and stole. You can't calculate that money. I can't even begin to give you a figure. It's well into 200,000. That's okay. I think we can still
Kim tried to stop, but couldn't. The urge had become habitual.
I had so many quit dates in my head. Tonight, I'm not gambling, I'm not drinking, I'm going home, I'm gonna be a good wife, I'm gonna be a good mother, I'm gonna start doing the right things. I said that 1,000,000 times to myself. And by the end of the night, once I'd made some money, I was ready to go gamble again. And I had no ability to stop it. 10 seconds?
Kim was broke, headed for a divorce, and deeply depressed.
Get your piece of fruit.
It was a critical turning point. She knew she needed to find help.
Kyron, there's some water in the freezer. I'll be right back now.
Being a Las Vegas showgirl is all about image. And as one of just 11 dancers in Crazy Girls, Rayma Alfred knows that a little bit of vanity is part of the game, which is why she wants to increase her bust line by 2 cup sizes.
I'm modeling my gel-filled bra, and I'm a 34A, and when I put this bra on, it lifts me up, gives me a little bit of cleavage, and it makes me a B. After my surgery, I'll be a C, so this is going in the trash, and I can't wait to see the new me.
Rayma hopes bigger breasts will also boost her career.
I know in my show, having breasts is not, it's not gonna put you in or put you out, but it's definitely an asset.
Every year, more than 300,000 breast enlargements are performed in the U.S.
Good morning. I have an appointment with Dr. Markman.
And your name?
And many
Rayma
of them
Alfred.
take place in Las Vegas.
You could just fill out this paperwork for me?
Las Vegas really has taken the lead from the national average. If you look at the number of implants that have been performed since 1992 to 2000, there's been well over a 200 to 300% increase. Barry Markman.
Hi, Rayma. Nice to meet you.
Nice to meet you.
Which explains why top plastic surgeons like Barry Markman are booked solid.
Now obviously, this one is too small. This is a 3-inch breast implant for your 4-inch or 5-inch breast. When I first initially came out here, I performed anywhere between 200 or 300 breast augmentations a year. Last year, my tally of breast augmentations and breast corrections tallied close to 650.
Okay, she looks really good. What size is that?
In the final pre-op consultation, Dr. Markman decides he will fit Rayma with a saline implant, historically the safest type.
Can I say nipple?
We have several implants here. This is a saline implant. It has saline on the inside. We fill it during surgery through this valve.
The amount of saline fill Dr. Markman uses will dictate the size of Rayma's new breasts.
In fact, putting in an implant of the proper size is almost like buying a pair of shoes or a dress. For example, if you're a size 5 foot, you buy a 5 shoe. If the diameter of your breast is 5 inches, of course then you want to put in a 5-inch implant. Breast augmentation is not for everybody. There's the possibility of poor scarring, of sensory deficit in the breast. There's a possibility of encapsulation or forming of a thick scar. There's a possibility of being too large or too small. So even taking all those factors together, we have a lot of happy patients out there with breast augmentation. You're all set? All the questions answered?
Yeah.
Okay, if you have any questions, I want you to feel very comfortable with the operation.
Tomorrow morning, Rayma will be back to undergo the surgery that will literally transform her image. That's next. The Las Vegas image is everywhere, and so are a slew of image makers. Relative to its size, Vegas has more plastic surgeons than any other city in the country, except Washington, D.C. And that's why 270 miles from Las Vegas, Los Angeles entertainment manager Ross Mark is making an appointment for the trip of a lifetime.
Hello?
Hi, doctor. It's Ross Mark.
Hi, how are you?
I'm your start patient for tomorrow.
Yeah, yes, we're looking forward to it.
Mark is having a preoperative consultation via telephone with a Las Vegas plastic surgeon.
I mean, basically, I want to get the fat sucked out of my chin.
In looking at the photographs, first of all, I think that we can make some considerable improvement in the contour and shape of the neck.
Tomorrow morning, Mark will board a plane to Vegas, where he'll undergo liposuction on his double chin.
I don't think I need to get it done. I don't think people will look at me and say, hey, look at that freak over there. I think it's more of a, I think if modern science can offer it, I think that it's something that you should take advantage of.
Hi, Dee. It's Elaine at Club Cosmetic in Las Vegas. How are you?
This surgical adventure has been arranged by Club Cosmetic,
Background. Now, I'll go ahead and I'll email that to you.
a company that specializes in surgery vacations.
I wanted to call and let you know that I did receive your email and I got your photos. Thanks.
Club Cosmetic isn't a referral service.
You did a really good job. It's great. Thanks.
It's more of a patient pampering service. The idea is to give surgical patients a little Las Vegas luxury to go with their stitches.
All right. We will talk to you real soon, okay? We can offer them show packages. We can give them massage, pedicure, hair appointments, tour packages, just to see the strip if they've never been here before, anything like that. Anything that they feel that they can do after their surgery to make them feel better, we can give that to them.
Would-be plastic surgery patients can call Club Cosmetic to handle all the details. The so-called Total Care Package runs $4,000 and up, but it covers everything. Need a board-certified surgeon? They'll pre-screen and put together a list of candidates. Airline and hotel reservations? They take care of that too.
How you been? Good. How are you?
Along with everything else.
You've not had anything to eat or drink?
No.
Including a 24-hour caretaker who babysits patients before, during, and after a procedure.
How far is the doctor from here?
The doctor's office is about 15 minutes. Everything in Las Vegas is pretty close.
I'm excited. You know, I'm already in Las Vegas, and a couple hours I'll be done with surgery. So the clock is ticking.
Yeah, let's see how you've changed over the course of your program.
At the Cenegenics Institute, Philadelphia dentist Arturo Garcia is about to undergo a series of elaborate tests. State-of-the-art machines will measure everything from how well he moves to how quickly he thinks. His doctors want to evaluate the effects of Garcia's year-long anti-aging program.
Good morning. Hi. How are you? Good.
How are you?
Great.
Ask 63-year-old Dr. Alan Mintz, the man who started Cenegenics back in 1997. And he'll probably say that he's living proof this healthy aging program works, because he doesn't just sell it, he lives it.
I work out every day. I get up around 4:30 in the morning because that's the only time I have. And I'm in the gym for about an hour and a half before I go into the office.
Dr. Mintz got his inspiration from his mother.
Here she is, the end of one marathon with my dad,
who became the world's oldest female marathon runner.
She looks as fresh as the moment she started it.
Ida Mintz began running at the age of 70 and continued well into her 80s.
And she won a lot of trophies. She must have run 15 or 20 marathons. Here are some of them. But she really was the reason that said to me, people don't have to get old in the traditional sense.
What Dr. Mintz learned from that experience prompted his interest in anti-aging medicine and became the basis of the Cenegenics program.
Every person who comes through here has a total examination head to toe. Before they get here, the women have a mammogram and a pap smear and colonoscopies. Men have the colonoscopies. We're very, very heavy on the front-end examination to make sure people are relatively, if not totally, disease-free. And if they have a problem, we want to send them back to their clinician.
Okay, now we're going to do your total bone density exam.
Garcia's evaluation will take all day.
Okay, scoot down about an inch. Perfect.
It begins with a bone density and body fat test.
This piece of equipment measures bone density, body fat, muscle mass, lean muscle, very important indicators of health.
Okay, for this portion, I'm going to have you put your arms behind your head like you're doing a sit-up.
This is a digital imaging camera.
Quarter turn to your right.
Which we record before and after pictures to show the progress of our patients physically.
Next, it's on to coordination.
The computer is going to light up different green dots at different times, and I'm going to have you go to the corresponding ones on this floor mat.
Okay. For that, Garcia is hooked up to a Cybex reactor, a state-of-the-art machine originally developed to test Olympic athletes. The Cybex is used to measure Garcia's balance,
2, 1, and raise the right.
Then to measure his stability,
2, 1, begin moving back and forth.
And finally, his agility.
It's much like the twister game. The goal with this is to really identify weaknesses. For instance, in an older person, if their balance is not good and they can't step off a curb, this is really important. So by identifying weaknesses, we can help people in an exercise program to be safe.
Tuck your elbows in and go ahead and begin.
Traditional weights measure Garcia's basic strength.
And we also want to figure out if people have particular weaknesses, how can we correct them?
What they're going to do is they're going to show you nonsense words like Big Mug.
And then the final test, a neurological chronometric assessment that will essentially measure how well Garcia's brain is working.
And respond left, no. I've never seen this picture before.
Previously used only at Stanford University, this test helps doctors evaluate Garcia's long and short-term memories, his cognitive skills, and any thinking problems he may have.
This helps us determine early on if there's any tendency to any kind of cognitive impairment, dementia, et cetera. So 10 to 15 years before it might show up clinically, we can identify it.
Total time spent, 6 hours. Total dollars paid, $1,700.
The results I'm hoping for are, improvements in my body type and shape, better bone density, more muscle mass, less body fat, quicker agility.
Dr. Garcia has devoted an entire year to improving his health. Now, in less than an hour, the final results will be revealed. Rough estimates put the number of gambling addicts in America at somewhere between 10 and 20 million. But nowhere is the problem more apparent than in Las Vegas. Close to 7% of the population, roughly 90 to 100,000 people, are believed to have the habit. Kim Bryant is one of them.
Anytime I went into a casino, it was hard. I got the adrenaline rush going. My pulse would start to race. My heart would start to beat fast because I was starting the progression of the disease. You know, I was into the disease at that point.
Living in Las Vegas didn't cause Kim's problems, but it did make it easier to avoid confronting them.
Vegas is not the problem. I am the problem. My compulsive, addictive personality is the problem. Vegas is not the problem. Vegas just gave me ways of acting out my problems.
Gambling in Las Vegas is a little different than it is anywhere else.
Joanna Franklin is the director of training at Tri-Meridian, a gambling treatment center in Las Vegas.
Many of the residents are surrounded by gambling all day, every day. It's in the laundromat, it's in the grocery store, it's at the gas pump, it's absolutely everywhere they turn. And we suspect that that means that there's a much higher prevalence of people with gambling problems in this city versus cities where you have to drive for 3 hours to get to a casino.
Car keys, where's car keys?
The turning point for Kim Bryant finally came after a night of heavy losses at the casino. Kim's boyfriend found her sobbing in the bathroom. She told him she wanted to die.
Hello? And I said, God, I've burned a lot of people. I've burned every bridge I've ever crossed. And I don't want to do this anymore. Please help me. Either help me or take my life. And that was my moment of truth.
Recent studies reveal that while men still gamble in greater numbers, women make up the fastest growing segment of the problem gambling population.
More women are making phone calls, more women are looking for help.
Even women who don't gamble, but whose husbands do.
I think that when he's in the throes of his addiction, I think the family ceases to exist because nothing matters except his gambling at that time. And it's not an intentional thing, but the gambling becomes more important than anything else.
For over 8 years, Cinda, who asked that we not reveal her last name, has been married to a compulsive gambler. His name is Paul.
I remember one night we were down here and I was ready to go home and he wasn't, so I took as much cash off of him as I could get a hold of. I believe on that night it was about $800, and he just kind of said goodbye, and I took all that cash and I'm walking down here, which isn't the best area in town.
I'd go to the $2 tables. $20, $40 would last several hours. It progressively got worse as the years went on, where you would spend hundreds or thousands in a night.
After years of habitual gambling, their marriage and finances were in ruin. Like Kim, Paul kept promising to stop. He even wrote it down.
I have told myself hundreds, no, thousands of times that I would quit gambling, and it hasn't stopped me. So now I am promising you, the person that I love more dearly than anyone on earth, that I will no longer continue to gamble. I solemnly swear that from this day forward I will gamble no more.
The family members sometimes pay the heaviest of all prices, and we don't measure it only in terms of dollars and cents. They are the innocent victims of what the gambler is all about.
According to addiction experts like Joanna Franklin and Rob Hunter, hardcore gambling addicts have no other choice than to seek treatment.
At the risk of sounding melodramatic, as fun as it is to see them get better, it is literally deathly dangerous to not treat it. As with any addiction, it's chronic and progressive. Later stage problem gamblers are the most depressed people I've ever worked with.
At 7:30 in the morning, Rayma Alfred is back at Dr. Markman's office.
Morning. It's my surgery, and I'm really nervous. I didn't get any sleep last night, so we'll see what happens.
The procedure is expected to take less than an hour.
Okay, now let's review. We're going to go ahead and we're going to use the nipple approach, and I'm going to make the incision right at this line here, as small as I can make it. Okay, let me get that one.
Dr. Markman uses the lines as a guide for the shape he will create in surgery.
Showed that, and see this left breast is a little bit farther out, so I'm going to try to open up the pocket just a tiny, tiny bit for you.
All that's left is to put Rayma under.
Dr. Bowman's a great anesthesiologist, and he'll take good care of you. Okay.
I need some sleep.
Yeah.
You're gonna get some.
You're going to get some.
And surgery can begin. Next, her transformation will be complete.
Come on, let's go. Byron!
One day I just had that clear vision of my life and what it was really like.
Kim Bryant wasn't ever going to overcome her addiction to gambling alone.
They call it a moment of clarity. I had that, and my life was just a mess. I looked at my life and it just disgusted me. I could no longer live that way.
The lives of Kim's children, Kamiko and Kyron, were at risk, and her husband had walked out.
Her gambling was, I guess, probably part of my mother and my father's divorce. Not that there's anything wrong with that. Thank God they're not together anymore. But it's probably the cause of that. I mean, my father and her would always argue all the time, so it wasn't that good.
What, you guys want to rent some videos tonight?
Help came in the form of GA, Gamblers Anonymous, a national nonprofit 12-step program similar to AA.
Too many kids in the program?
These people had had problems with gambling. They had lost everything. They had hit their own bottoms, and they inspired me. They told me how I could overcome gambling.
Hey, how you doing? Good, how you doing? Same old 6 and 7.
In Las Vegas, Kim found 20 local GA chapters that offered group meetings day and night. She started going to as many as she could.
And they told me that I needed to be vigilant in my recovery, that I should attend meetings on a regular basis, because it was in those meetings that I would find people who could relate to me and could help me through this difficult time.
The meetings would soon help Kim turn the corner towards a new life.
Good luck at basketball.
Lots of things are a part of that process. Picking up the phone list, going to a meeting, calling the sponsor. We're going to give you one more tool tonight to work with.
At the Tri-Meridian Center, Joanna Franklin is counseling a group of compulsive gamblers.
Today's a great day.
The structure in this program is all gambling specific. If we're going to start at number 1, the gambler that can see the racing.
Each year, over 200 compulsive gamblers come here for treatment.
I've got lots of different choices that
Clients might be corporate vice presidents or people living on the streets, but all have lost money and put their lives at risk.
The highest that I've seen is $36 million worth of debt, where the man bankrupted his own personal business as well as the business for the family, and it all went in less than 3 years. But it's not the money, because at the other end we had a very young college student who ended up killing himself for $6,000 debt. It just is the devastation when people don't feel there's any hope and they can't see a way out. There's a brick wall between you and your intentions and making it happen.
Tri-Meridian is one of only 2 gambling-specific treatment centers in Las Vegas. This privately run program is structured around an intensive 10 to 20-week cycle of group therapy.
I'll just get on out there and cut the grass. But of course,
Small group therapy, I think, is more effective in all the outcome research because in addition to the combination of therapy inputs that the patients get, there's a tremendous amount of exchange between the group members themselves. There's a tremendous bonding that occurs in the group, and I think somehow or other that's part of the power of this treatment also.
Rob Hunter is a clinical psychologist at the Problem Gambling Center, the only other gambling-specific treatment center in the city. This nonprofit group treatment facility sees the hardest luck cases of all.
Typically, the stories that we hear from our gamblers are very similar to the stories that you hear from cocaine addicts in a cocaine clinic or from alcoholics in an alcohol rehab facility.
Give me a 10.
What differentiates pathological gambling from the other addictions, the gamblers don't tend to have a sense of illness. They don't perceive themselves ill as often as they perceive themselves as just weak or stupid or evil somehow.
The success or failure of treatment is measured in small steps. Quitting is the first. Rebuilding a life makes up the rest.
We, by and large, take the view that this is a chronic, long-standing disorder and that it is a one-day-at-a-time kind of a process. And the best that anybody can do that has this problem is work for the rest of their days to not let it get control of them again. They are recovering.
Recognizing that compulsive gambling is a growing problem, some of the casinos are becoming more proactive. Jan Jones, a vice president at Harrah's, believes small efforts can make a big difference.
We've worked in putting together programs and training our employees in trying to recognize what may be pathological addictive behavior and then being able to tell customers where to go to get help. We post numbers where a customer can call if they believe they have a problem. In our marketing, we're very careful. We don't cash welfare checks. We don't cash unemployment checks. We do not want problem gamblers. That's not our business.
Okay. Off to sleep you go.
Rayma Alfred is about to be transformed.
Just make sure everything's okay here.
From a 34A to a 34C.
Good. Okay.
She's just one of more than 600 breast implant patients Dr. Markman will see this year.
Everybody ready?
Dr. Markman makes the first incision using an electrocautery, an instrument with a heated tip. It cuts through the skin layers with minimal bleeding.
Incision here. You come straight down.
Dr. Markman must decide whether to go above or below the pectoralis muscle. This will determine the position of the saline implant.
And trying to go below the muscle on her is almost a recipe for disaster because the muscle is not long enough to accommodate the implant in the proper position.
After further exploration, he makes the critical decision.
So I want to commit myself at this point, after seeing it, to go above the muscle. How many do we have in here now? 2. 2.
Rayma is now ready for the implant. At this point, the implant is only partially filled with saline.
And the implant goes in, and we have 120 cc's out of the possible 400 in now. So what we're going to do is we're going to fill it as we go.
While Markman smooths out the pocket, the nurse pumps in more saline solution.
420.
Markman repeats the same process on the other breast. When he feels confident that the breasts are the right size and shape, he does a final visual check.
Everybody looks good laying down, so we try to see how she looks sitting up. The more you fill the implant, the ballier it looks. So we're trying to get a real natural result, and this looks pretty good. This looks pretty good.
A few stitches close her up, and Rayma is ready to be bandaged and then awakened.
You're doing well. Okay.
She'll likely have moderate pain for about a week and swelling for at least 6 weeks.
The recovery time will vary with the position of the implant, whether you put it above or below the muscle. But the recovery time is normally anywhere between 1 week to 3 weeks to return to about 90% of your ability to do simple tasks such as driving a car, going to work if you don't do a lot of heavy lifting. Expect to have a full recovery in about 3 months.
Rayma's biggest moment is coming up when she gets back into her Crazy Girls costume for the first time.
Okay, I decided I don't want to get the surgery.
Oh,
With his personal caretaker by his side, the highlight of Ross Mark's Club Cosmetic surgery vacation is about to begin, the liposuction itself.
Okay, now
Liposuction is the most popular plastic surgery procedure in the U.S., with over 350,000 performed last year. The nurse takes pre-op photos, so Ross can compare his befores with his afters a few weeks from now.
Young man,
Hey,
how are things going? Finally in person. Have a seat, relax.
Then, for the first time, Ross meets his surgeon, Dr. Julio Garcia.
We talked on the phone. Any last-minute questions or anything?
I think I'm okay.
Come on with me.
Using photographs sent to him via email, Dr. Garcia devised a plan before Ross even set foot in Vegas.
I've gotten all his medical information history that he's faxed to us. We also have digital images that he's sent to us.
First page is your anesthesia.
Before the liposuction, Ross's weight and blood pressure are checked, and his medical history is reviewed a second time.
With Ross, well, what he's chosen to do is liposuction of the neck, which is a removal of the fat below the skin with a small metal tube about the size of a straw. So we're going to be marking the center part here.
Dr. Garcia begins by marking the area where he plans to remove the fat.
Excellent candidate for this. For a lot of reasons. It's localized, number one.
Yeah.
And your skin is really good shape. You know, you don't have an old person's skin. It's young skin, it'll shrink real well.
I gave you a medication called Versed.
We're actually going to inflate that area to 2 to 3 times the size it is now. The purpose of that is to burst some of the fat cells, and then through 3 small little holes, one underneath the chin and then one behind each earlobe, what happens is these metal straws are placed and then the fat is vacuumed out.
Is that the doctor?
Yep.
In all, Mark will lose 200 cc's of fat, or roughly 13 tablespoons.
So if you can imagine about an 8-ounce piece of steak or about 3 sticks of butter laying over that area.
In less than an hour, Ross Mark will be done and off to an opulent recovery.
You picking out a good dream?
Hey, Art.
Hey, Dave.
How you doing?
Good to see you.
Thank you. Man, you're looking good. Thank you.
Back at the Cenegenics Institute, the dentist from Philadelphia is about to find out if his anti-aging program is paying off.
Well, I want to go over some results with you. These are
Following a battery of tests, Dr. David Leonardi is ready to give Art Garcia his results.
The testosterone level's gotten a little bit higher than we'd like it, so we're going to cut back on the dose of gonadotropin.
Okay.
Besides the strength and stamina evaluations, a complete blood workup was done to check Garcia's hormonal levels.
And your IGF-1, which corresponds to growth hormone, has risen into the perfect range, what we consider the
The analysis also tells Garcia how well his brain is functioning.
From the standpoint of short-term memory, you scored very well. From the standpoint of immediate memory, you also scored well. And also working memory, which is executive function, your ability to use your memory to apply to immediate problem solving.
And how his weight and body fat have changed.
Your muscle mass, your lean body mass, has increased by 8.8 pounds in just 5 months.
That's great.
Your body fat has dropped by 13.2 pounds.
Garcia's supplement regime, which includes high-potency minerals, calcium, magnesium, fatty acids, and ginkgo biloba, along with antioxidants, seems to be helping.
It was kind of what I expected. I mean, certainly I would like to say I lost 20 pounds. I did, and I lost 4 pounds. But, you know, the weight numbers are not as important as like what your body's made of. I'm happy I lost 13 pounds of fat and picked up 9 pounds of muscle.
Any questions?
No, I think you covered everything pretty thoroughly.
Just give me a call, and
Right.
otherwise I'll be talking to you in August when we do your next set of blood work. Okay?
Excellent.
Starting to give you a little bit of local anesthesia.
In Dr. Julio Garcia's operating room, Ross Mark is about to have a half pint of fat liposuctioned from his neck.
He's relaxed and he's snoring. A little snoring is good.
Fat accumulates where there are low concentrations of a naturally occurring chemical called epinephrine.
Where that chemical is not very densely found, those areas will be tough to lose weight. So the neck region is one, men's bellies, men's love handles. Women are different. They'll gain weight more in their hips and in their thighs. One more injection and we'll be done.
Dr. Garcia carefully fills Ross's neck with an epinephrine-based solution. It will get reabsorbed by Ross's body.
What we're doing is basically injecting about the amount of solution that I'm going to expect to remove. So he'll be getting what we call a 1-to-1 ratio of fluid to what we're going to aspirate or suction out. And that's been one of the advances in liposuction surgery that's allowed us to do areas. Doing this technique minimizes the blood loss to a great degree and allows us to remove greater amounts of fat safely.
Then he can begin to remove the fat.
You guys ready to rock and roll?
He makes incisions under the chin and behind each earlobe.
This is the cannula that we're going to be using today. Metallic, hollow, and anywhere from 1 to 3 holes on the tip with different sizes.
Then uses a pump connected to the cannula to vacuum out the fat deposits.
I'm going to start right underneath the skin, take the superficial layer off first, and then progressively go down deeper and take more of the fat off.
Dr. Garcia has elected to use traditional wet liposuction with fluid injection, not ultrasonic liposuction, which generates heat to melt the fat.
Unfortunately, there's a lot of very superficial nerves here in our neck, and nerves are ensheathed in fat, just like a wire has covering. And I prefer not to use that technology here because we don't want to injure the sheath of the nerve, causing pain on a long-term basis.
During the procedure, Dr. Garcia makes about 1,000 strokes with the cannula.
I don't like bulky things when I have to stroke 1,000 times. But you can see already, it's really shaped down quite a bit.
When 200 cc's of fat have been removed, a couple of stitches sews Ross back up.
Ross, how you doing?
Then he's ready to be brought to.
He'll have my beeper number, and I'm on call 24 hours a day. So if he has a question or concern, I'd rather be called 20 times asking silly questions than for him to leave something. So it's that kind of security blanket that we like to give those patients. You remember much?
Ross won't get to see the full result for about 6 weeks when all the swelling is gone. But later, when he wakes up, he'll start the final leg of this surgery vacation, the fun.
We're going to be taking you down there, and then we'll be checking in on you later. You'll see me bright and early in the morning, okay?
Okay.
All right, Tiger.
Thanks,
Any
Doctor.
questions, just give me a holler.
Wearing a post-op mask to control swelling caused by the liposuction, Ross Mark is about to begin the second part of his surgery vacation.
Hi.
So I'll take them off.
How are you?
Good.
How are you feeling?
Part of a day is devoted to recuperation at Stone Creek Hospital, a plush post-op facility.
They have their own private chef, the private rooms, they have cable, the round-the-clock nurses, they keep ice on the patients, for the 24 hours. And it reminds me of the Four Seasons.
The suspense is too much. Ross takes off the headdress to see his chin, even if it is still swollen.
Here you can really see a big difference. And I'm sure, really happy and really sure that there will be a big difference.
Bandaged but happy, Ross can now enjoy some of the Vegas lifestyle at Harrah's Las Vegas.
Hit. Stick.
Good
luck to you. No more betting.
I did tell some people that I had surgery, but people I don't see every day, like maybe once every 2 weeks or 3 weeks. I'm curious to see their expression. I'm not going to tell them. If they ask me, I won't lie to them. But I'm very curious to see what people say. That's more exciting to me than anything.
We have a winner.
Why were you late? I had to work late.
Kim Bryant knows better than to stake her life on luck. 10 years of Gamblers Anonymous meetings has taught her how to manage her compulsion to gamble.
How much green beans you want? 0.
Dollar by dollar, Kim is paying back her creditors. And day by day, she relies on her Gamblers Anonymous meetings for support.
People in recovery, they come from here and here and here and here, and we all end up at the bottom of the pit. And then we all start this spiritual path, of those of us that stay. We start this spiritual journey together.
These ribs are good, huh?
Although Kim's gambling days are over, the process of recovery will continue for the rest of her life.
For me, it's just one day at a time. The most important thing I do is what I do in this 24-hour period. That's what I've learned in recovery. Okay, I gotta go.
And when people ask Kim why she doesn't leave Las Vegas, she has a ready answer.
Well, we have a saying in the program, wherever you go, there you are. So if you leave and you have that problem, wherever you go, that problem's gonna be there.
Years ago, if you left Nevada, you left casinos. Today, we've got 6 states that are riverboat states, 26 states that have casino-like gambling because of tribal gambling that's available with the Indian Gaming Act that was passed in 1988. And the internet makes it available to everybody all the time, regardless of your age, your background, or your ability to pay.
Cinda and Paul knew escaping Las Vegas wasn't the solution either. Paul went to Tri Meridian for treatment and has since tried to substitute his compulsion for the casino tables with a more benign interest in the internet.
Anything I can find to do takes the place of gambling, and it's something that I need to focus on to, to have some passion for, and that's very hard to find in anybody's life, I think, but in mine, I'm just like, I need something that I can really get involved in and feel that passion that I did when I was gambling, that emotional high. You start.
Okay, I'm gonna start.
Today, Cinda and Paul are piecing together a new future.
We truly live kind of the one day at a time. We'll get through today, and tomorrow we'll worry about tomorrow.
Back at his dental practice in Philadelphia.
Yeah, it looks good. I think, Kathy, we can do a great job for your smile, but I'm also seeing some...
Dr. Garcia's goal is a better life, not necessarily a longer one.
My first long bike ride this year, I did 60 miles, and I was tired when I got home, but within 3 hours I was fine. I recuperated completely. Last year, that same bike ride took me 3 days to get over, being dehydrated and tired. I wasn't a regimented person when it came to eating and having good health, but now I'm very focused on it, and it's become part of my routine.
Rayma Alfred is back at work at the Riviera for her first show with her new figure.
Well, it's been a month since I had my surgery, and I love the new me. I love my new look, especially in clothes.
This is also the first time Rayma hasn't needed padding to fill out her costumes.
Wish me and my girls luck.
Over here, over there, those crazy girls are everywhere.
When the show is over, so is the worst for Rayma. Any lingering doubts are gone.
I can honestly say that before I did it, there was always something in the back of my mind saying, should I really do this? Is this the right thing? Now I know for sure I would do it again.
The beat, just watch the beat. So everything's jumping in the room, there's something